Hey, all you cool cats and kittens. My name is Maurice Juwono.
My name is Marissa Unzueta.
My name is Edvard Baratyan.
Today, we're going to be diving into the case study on grade 2 ankle sprains. Ouch! Our patient happens to be a 30-year-old female who's presenting with grade 2 right ankle sprain sustained from rolling an ankle in a volleyball game. She has experienced pain and swelling of the right lateral ankle for 2 weeks, happens to be a marketing director, and she's been playing volleyball since she was 13 years old, and would like to return to playing as soon as possible. She's had 2 prior ankle sprains, 1 on each side, and she happens to be 10 weeks pregnant. So she's been playing indoor volleyball 3 times a week prior to the injury, and also does high intensity interval training twice a week, and is left-handed. So what does a grade 2 ankle sprain mean? Well, to start, a sprain is an injury that occurs on the bands of tissue that holds the 2 bones together, known as ligaments. Most common ligaments affected are the posterior talofibular ligament, calcaneofibular ligament, and the anterior talofibular ligament, which is located on the lateral side of each ankle, which is the precise location that can get really overstretched anytime the foot and ankle roll in too far. Now that you know what ligaments are affected, let's talk about the grades. The grade 1 involves stretching or slight tears in the ligament that results in mild swelling and tenderness, but the ankle still retains stability and walking isn't too painful. On the other end, a grade 3 is a complete tear of the ligament with severe swelling and bruising. And not only is the pain intense, but walking is unlikely due to the instability. Our patient finds herself right in the middle between those two with a grade 2, and she's got significant but an incomplete ligament tear. And so there'll be moderate swelling and bruising. Walking is going to be painful, but there is a little bit of ankle stability. Patient goals: return to volleyball as soon as possible. She's got a little one on the way, and her window of spiking balls over the net is closing. However, if that timeline is too ambitious, reducing the swelling and managing pain so she can return to functional level until after childbirth will be the next best thing. As joints tend to loosen due to the hormonal changes that relax the ligaments, working on improving that ankle stability will be crucial as to avoid any re-injuries or chronic ankle sprains. Marissa, would you like to touch on some tests that our patients might encounter in the PT clinic?
Of course. Thank you, Maurice. I would love to touch on some of these tests and measures that are done in the clinic. So on the far left, we have the figure 8 girth measurement. It's basically measuring the swelling of the ankle joint as well. So the ligaments that Maurice was touching on earlier. You can test with the next 2 videos that we're going to go ahead and watch, which are going to be the anterior drawer test and the calcaneofibular ligament test, which we will start right about now.
The ankle anterior drawer test creates an anterior translation of the talus. To perform the test, hold the patient's heel with your forearm against their forefoot and the ankle in 10 to 20 degrees of plantar flexion. Stabilize above the ankle, then draw the foot forwards. An increased laxity on the lateral side of the ankle compared to the medial side of the ankle indicates a positive anterior draw test and a potential anterior talofibular ligament tear. This test can also be performed in the prone position as shown here. The calcaneofibular ligament stress test can be used to detect a sprain of this ligament and the lateral ligaments in general. To perform the test, face the sole of the foot and grip around the heel with the outer hand. Place your fingers over the anterior joint line and your thumb underneath the arch of the foot. The ankle should be in a neutral plantar-grade position. Provide a firm medial force through the calcaneum. A positive test is indicated by pain over the lateral aspect of the ankle. And increased laxity would indicate ligamentous rupture.
So with these few tests that we did just watch, they will be within the first couple days when there is some acute swelling and inflammation. The next slide that we're going to go ahead and check out is going to be after once she can build stability and be able to hold herself on that one ankle. As far as assessing the strength, you can go ahead and do a square hop test, which is shown in the left picture there. It's just a jumping in and out of the square. It's after a few of the exercises that Edvard is going to show us. On the right hand side is the star excursion balance test, which is also after stability has been built in a few of those ankles, and we're going to check that out right now. And so there are a few deviations as far as that star excursion balance test that we were just looking at. It can be due single format with also a few other heel touches, toe touches, which Edvard is now going to go ahead and touch on.
Although there are many benefits to E-stem, TENS, ultrasound, it may be contraindicated because the patient is pregnant. Just for the sake of improving a grade 2 ankle sprain, patterned electrical education can stimulate, and they can fire patterns of muscles like the agonist and antagonist. So you can do her dorsiflexors and plantar flexors, everters and inverters, fibularis brevis and tibialis posterior, to kind of re-educate those muscles. And this approach is very high intensity and it would use electricity. And so we may want to use a cold pack with this patient. If there is pain, we may want to use a hot pack. In acute stages, to reduce the swelling and inflammation, the best choice to improve the patient at the clinic, which is something she also can do at home, would be to rest it, ice it, provide compression and elevation. As far as traditional forms of E-stem and TENS, that could be possibly up to the doctor or the PT's discretion to see if it would be indicated in this condition. In the next slide, some activities you can do at home, which are homework. She can do it before she goes to bed. She can trace the alphabet with her toes, which will encourage ankle movement in all directions. She can trace the alphabet 1 to 3 times. She can practice heel raises, and that would work on her dorsiflexors, or she can do plantar flexion exercises to help strengthen her gastrocs. And she can do ankle eversion and inversion using the resistance band to help her strengthen the muscles that are surrounding the injury site of injury. And because the patient is coming off of crutches and wearing a boot or brace, her previous ankle sprains are and will be a risk factor. So we want to strengthen her enough so that in the future, another varus type of attack on her ankle won't compromise the integrity or the joint stability. That way, if she does continue to go back to the clinic after doing her homework, manual muscle testing and goniometry of her plantar flexors, dorsiflexors, everters, inverters would reveal slightly more strength or increases and gains in range of motion. In the next slide, we can look at an example of one of the plantar flexion exercises. Kind of a rule of thumb or a principle that you could abide by is that you want to hold for only 15 to 30 seconds, since no further length will be gained by holding it for longer. And also, when doing plantar flexion exercises, even you're working on your gastrocs, doing them for more than 2 to 4 reps, you may not be necessarily able to gain or lengthen further the muscle that you are working on. And by using exercise like this, she can help maybe understand how to focus on working the muscles around her site of injury. In the next slide, we focus on some of the proprioceptive factors, which is also a piece of the rehab puzzle. The patient can begin with a single leg stance with her eyes open to see how long she can stand on her one leg. And then she can progress to a single leg stance on a pillow. And then she can also try single leg stance with her eyes closed, and tossing a ball while balancing would make it even harder. So as she continues to make the proprioceptive component of the exercises more difficult, she is able to focus on some of the other stretching exercises like the star or staying within the square. And so she can improve holistically at all the different types of training she's receiving while improving her grade 2 ankle sprain. The next slide is a single stance balance retraining test. This is designed to re-educate her stance time on the affected extremity, which will come up during gait whenever she has to go to single limb support. Even though most of gait she'll be using both of her legs, whenever she's on just one leg, like mid stance, or she needs to use one leg to move forward the contralateral leg, she's able to not suffer from not being able to stand on that stance leg for as long as she needs to. Finally, with all these exercises, she could get really back on track and eventually return to her plan, which is to play volleyball. And in the next slide, you can see her showing off with her new restored ankle knowledge. And because she followed her PT's plan of care, she can further prevent these type of injuries and improve on the court as well.
All right. Thank you for listening. As our presentation has been changed to a recorded format, there will be no questions. Have a nice day.